Assalamu alaikum, dear students. This is lecture of gross anatomy. The topic of today is the anatomy of the lumbosacral plexus. For first professional MBBS students, I am Dr. Karimullah, Demonstrator Anatomy Department, GKMC Swabi. The objectives of discussion will be to know the lumbar and the sacral plexus. The lumbosacral plexus, jointly we also call it. Why? Because the lumbar plexus and the sacral plexus are joined by a trunk that is called the lumbosacral trunk, that is arising from the lumbar fourth segment. We will also discuss its diagrammatic representation and its nerves and the origin of the nerves. We will also discuss its clinical aspect as well. Dear students, I hope you remember once I told you in the discussion of the brachial plexus that all the plexuses in the body are found by the anterior primary rami of the spinal nerve. The posterior primary ramus goes to the back and supplies the back, the muscles of the back and everything along with the skin. Well, here we are concerned with the lumbar plexus. So the lumbar plexus is formed by the anterior primary rami of the lumbar 1, 2, 3 and 4th segments. The branches are iliohypogastric and ilioinguinal, and these are arising from the L1. Over here, if you concentrate upon the diagram, the T12, that is the subcostal nerve, is also taking some part in the formation of this particular lumbar segment. Then the genitofemoral nerve, it is arising from L1 and L2. The lateral femoral cutaneous nerve or the lateral cutaneous nerve of the thigh, it is arising from the L2 and L3, but from the posterior division, because these rami they go onward and divide into posterior and the anterior divisions, like the brachial plexus, if you remember. The femoral nerve, it arises from L2, L3 and L4 posterior division. The obturator nerve, it arises from L2, L3 and L4, but the anterior division. The iliohypogastric and the ilioinguinal nerve, they arise from T12 and L1. These both run in between the transversus abdominis and internal oblique muscles. These are the muscles of the anterior abdominal wall, and they run in an oblique fashion downward and become sensory and supplies the skin over the inguinal region and scrotum, and this is shown in the diagram on the left side below. The genitofemoral nerve, its root value is L1 and L2. It arises from L1 and L2 as shown in the diagram. It splits into two branches, the genital branch and the femoral branch. The genital branch supplies the cremaster muscle in males, the spermatic cord, the tunica vaginalis, the interior scrotal and the labial skin, and the femoral branch supplies the skin below the inguinal ligament. The lateral femoral cutaneous nerve or the lateral cutaneous nerve of the thigh. It arises from L2 and L3 posterior division. It supplies the iliac fascia, the peritoneum of the iliac fossa, and the lateral side of the thigh. The obturator nerve, it arises from the anterior division of the L2, L3 and L4, and the muscles it supplies is the obturator externus, the adductor longus, the adductor brevis, the gracilis, if you remember the adductor compartment, and it also supplies the hip joint. The cutaneous supply is shown by a small yellow strip on the medial aspect of the thigh. The femoral nerve. It is arising from L2, L3 and L4 like the obturator nerve, but it arises from the posterior division. The muscle it supplies is the iliopsoas, the pectineus, and the sartorius, the quadriceps femoris, and the hip joint. It supplies the maximum of the thigh extensors. From its stem, cutaneous nerve arises. These are the anterior, intermediate, and the medial femoral cutaneous nerves. I have told you in the discussion of the thigh. And after passing through the adductor canal, the femoral nerve becomes sensory nerve, and it supplies the skin over the medial aspect of the leg and the periosteum of the tibia and the medial side of the foot up to the big toe. Short muscular branches from the lumbar plexus. These are for the psoas major muscle and the iliacus muscle. As the lumbar plexus is formed upon the mass or the belly of the psoas major muscle, it gives supply to the psoas muscle and also to the iliacus muscle. The sacral plexus. The formation of sacral plexus. The lumbosacral trunk, which is formed by the union of the L4 and L5, form the trunk which joins the lumbar plexus with the sacral plexus, and the sacral plexus is formed by the interior primary rami of the S1, 2, 3 and S4. Upon the interior surface of the peripheral muscle, this particular plexus is formed. The plexus enters the pelvic cavity anterior to the sacroiliac joint. In this slide, you can see how the lumbar 4 and 5 interior and posterior both of the segments, they unite to form the lumbosacral trunk, and the trunk goes downward and unites with the S1, S2, S3 and S4 segments, and results in the formation of the sacral plexus and the big nerve that is called the sciatic nerve, which is composed of the posterior and the interior segmental fibers, which we will discuss in the coming slides, inshallah. The divisions of the sciatic nerve, actually these are two nerves, the tibial and the common peroneal nerve or the common fibular nerve. They are bundled in the single sheath. They separate at the apex of the popliteal fossa on the back of the knee joint. In 12% of cases, they separate as they leave the pelvis. The superior and inferior gluteal nerve arise from the sacral plexus. The superior gluteal nerve has root value L4, L5 and S1. They supply the gluteus medius, the minimus and the tensor fasciality, and has no cutaneous or sensory supply. The inferior gluteal nerve has L5, S1 and S2 segmental value, and it supplies the gluteus maximus muscle. Some nerves are arising from the sacral plexus by the name of the muscle, and these are the nerve to piriformis from S1 and S2 for the obturator internus L5 to S2, L quadratus femoris, L4, L5 and S1. The perforating cutaneous nerve, it arises from S2 and S3 and supplies this small area on the lower medial side of the buttock. The posterior femoral cutaneous nerve, it arises from S1, S2 and S3 and supplies the posterior gluteal line from above downward. It goes on the back of the thigh and crosses the popliteal fossa and reaches at the mid calf or the back of the leg. The sciatic nerve, it arises from L4 to S3 segments. Uh, in the thigh, it supplies the semitendinosus, semimembranosus, biceps femoris. The long head of the biceps femoris is supplied by the tibial nerve, and the short head is supplied by the fibular nerve. And the adductor magnus, the medial part, is supplied by the tibial nerve. The divisions of the sciatic nerve are the common peroneal or the common fibular nerve. It arises from the posterior division from the L4 to S2 segments, and the tibial nerve, it arises from the anterior division from L4 to S3 segments. The sciatic nerve divides in the popliteal fossa into tibial and common fibular nerve. The common fibular nerve is arising from L4 to S3 segments. It supplies the extensors and peroneal compartment of the leg and first two dorsal interossei of the foot. It curls, as is shown in the diagram, around the head, the neck of the fibula, and in the peroneus longus, it descends downward. Its cutaneous supply is lateral aspect of the leg, ankle, or the dorsal aspect of the foot and the toes. Clinical relevance. Damage to common peroneal nerve. The cause may be fracture of the head or the neck of the fibula. The result may be paralysis of all the interior and the lateral muscles. The interior, the extensor muscles of the leg, and the lateral, both of the peroneal or the peroneal muscles. The result is foot drop, and the loss of dorsiflexion is the loss of the extensors, and the loss of eversion is the loss of the peroneal muscles. There is loss of sensation on the dorsum of the foot and the lateral aspect of the leg. Now the main stem of the common fibular nerve divides into superficial and the deep fibular nerve. The superficial nerve goes down and supplies the peroneal muscles, and the deep nerve goes down and supplies the extensor or the interior muscles. The superficial fibular nerve, it goes lateral to the neck of the fibula, and it is less vulnerable to damage. It supplies the peroneal, and its cutaneous supply is the lateral side of the lower leg and the dorsum of the foot. The damage to superficial peroneal nerve results in loss of eversion. The deep fibular nerve, it passes on the lateral side of the neck of the fibula, and it is very vulnerable to get injured. It supplies the interior compartment. It divides into lateral and medial parts. The lateral parts supply the extensor hallucis brevis and extensor digitorum brevis. The medial part is cutaneous, and it supplies the skin in between the first and the second toes, as shown in the diagram. Damage to deep peroneal nerve. The presentation is foot drop, and the characteristic sign is high stepping gait, as shown in the diagram. The tibial nerve, its root value is L4 to S2. It passes through the popliteal fossa on the popliteus muscle. Its branches are articular to the knee and muscular to the posterior compartment of the entire posterior leg. The cutaneous branches of the tibial nerve. These are the medial sural cutaneous nerve, the lateral calcaneal nerve, the medial calcaneal nerve, and the lateral dorsal cutaneous nerve. These are shown in the diagrams given in the slide. The branches of tibial nerve at the ankle. These are the articular branches to the ankle joint and the branches passing beneath the flexor retinaculum on the medial side. These are the medial plantar nerve and the lateral plantar nerve as shown in the diagram above and below in the on the medial aspect and the lateral aspect as the yellow and the green branches. Damage to the tibial nerve. There is paralysis of tibialis posterior muscle. It results in loss of flexion and inversion of the foot. There is difficulty in getting the toes off the ground. The toes are dragged against the surface of the ground. There is a shuffling gait. मरीज की चाल shuffling की किस्म की होती है. The characteristic signs are clang of the toes as shown in the diagram, and there is sensory loss on the shoulder aspect of the foot. Dear students, though the topic was a bit tough, but I hope you would have followed me. Thank you very much.